An open message to Parliament. How will the Natural Health Products Bill affect us? In this presentation, we look at examples of what products are affected and why. What do the public want? The public are aware that research findings on diet, nutrition and lifestyle indicate that there are proven health benefits. Over 50% of the public use natural health products and alternative approaches to healthcare. The public want more information about what products to use. They want to know that they are using the right product safely. If an individual suffers from a chronic or serious illness, they need to retain their options to research and choose the most effective treatment. The bill will regulate all products that claim to benefit health. The Ministry of Health has already published a draft list of 5,500 approved and/or restricted ingredients. Let's answer the public's first question: are these ingredients safe? The permitted list of the Natural Health Products Bill includes 3,000 synthetic and chemical additives. A closer look shows that the permitted list includes many additives which are suspected of causing cancer or illness, including FD and C red number 2, amaranth, number 3, erythrocin, number 4, ponzo, all banned in USA by the FDA. In 2007, a study in the UK found a possible link between 6 food dyes, a preservative, and hyperactivity in children. All these compounds are permitted by the bill. Thousands of artificial fragrances and flavors have been approved, even though they have not been tested properly. Pre-approved synthetic product: raspberry flavored soft drink. This cheap, popular drink is available in New Zealand supermarkets. All of its ingredients have already been approved under the bill. These include sugar, predisposes to obesity and aggravates diabetes, E330 synthetic citric acid, synthetic raspberry flavor, effects unknown, E211 sodium benzoate, implicated as a possible cause of hyperactivity when used with E122, color E122 carmozine, banned in the United States, Sweden, Norway and Austria, artificial sweetener E961 neotame, similar to aspartame and banned in organic products. US FDA application noted adverse reactions. Dr. McCullough recommends this be avoided at all costs. The Natural Health Products Bill will allow this synthetic product to be marketed as a natural health product. We thought that this was a bill about natural health products. The wholly unjustified approval of thousands of chemicals under the bill will perpetuate past regulatory mistakes and permit potentially dangerous chemicals in natural products. Has this list been approved with public safety in mind, or have we become part of a plan to facilitate the adulteration of natural health products with unsafe ingredients? Large corporations are poised to use the provisions of this bill to offer cheap, unhealthy synthetic products masquerading as natural health products to an unwitting public. We are talking serious health issues here. During the last 20 or 30 years, there has been a huge expansion in chronic disease, including cancers, diabetes, heart disease, anxiety, depression, and other mental and physical illnesses. No one knows the exact causes, but poor nutrition, food additives, and environmental pollution are all suspected. Over 2,000 new chemicals are registered each year. There has been a rapid expansion in the use of chemicals in food. Many of these have been approved without sufficient scrutiny. Using discredited principles such as substantial equivalence, additives that are similar to but slightly different from natural compounds have been approved under the bill, even though it is well known that very small differences in chemical structure can cause serious side effects. Second question: will the bill provide useful information for consumers? Under the bill, all ingredients have to be pre-approved. Any supplier will pay $200 annually for each ingredient used. To make a health claim on the label, you need to pay $5,000 to the Ministry of Health for each application and for each mild condition your product claims to benefit. You are not allowed to claim that a natural health product can benefit a serious health condition. If it is considered that your product has therapeutic value, you will be required to pay $88,000 to register it as a medicine. Only a medical doctor will be allowed to prescribe it. An EU report found that natural health products are 45,000 times safer than pharmaceutical drugs. Despite this, suppliers will have to comply with pharmaceutical style regulations and undertake frequent costly testing of ingredients and products. If you are selling 300 products to the public and each one benefits 2 mild conditions, the application fees alone will be $3 million before you have even begun to prepare evidence. The experience in Australia has been that the preparation of a single application can cost in excess of $100,000. These restrictions are so costly that most suppliers plan to refrain from making health claims. Many will go out of business. The net effect of these regulations will be that consumers will have less information than they did before. Restrictions on scientific information regarding serious illness. Did you know that the simple kitchen spice turmeric is effective in preventing bowel cancer? New Zealand has one of the highest death rates from bowel cancer in the developed world. Studies show that garlic, ginger, turmeric, thyme, rosemary, sage, spearmint, and peppermint all inhibit the growth of colon cancer cells. A study found that 1/3 of patients with end-stage bowel cancer for whom no other treatment options existed improved after treatment with turmeric extract. If the Natural Health Products Bill is passed, I would not be allowed to tell you this and could be liable for a $50,000 fine. Restrictions on free speech. It has been proven for years that garlic benefits heart conditions. No one selling garlic will be allowed to communicate this factual scientific information. Thereby, the bill will restrict free speech and suppress matters of fact. Restrictions on health claims. A consignment of this product was seized by MedSafe officials in May 2016 and destroyed because the label made this unapproved health claim: apply to the chest, throat, and back for three-way relief from blocked nose, cough, and body ache. Thousands of products will be snagged by this rule. Restrictions on dose. The bill has ruled that the maximum daily dose of vitamin B12 is 50 micrograms. This product is commonly used by people who are deficient in B12. It has 20 times the maximum daily dose, and so it will be banned. A typical Indian or Thai meal may contain 50 grams of tamarind. The maximum daily dose of tamarind that has been permitted by the bill is 500 milligrams. That is 100 times smaller than the amount you might consume in a meal. Civil servants have been employed to make up this ridiculous rule, and hundreds more like it. Banned ingredients. Even though this traditional coffee substitute contains only natural plants, it will be banned by the bill because it contains an ingredient that is listed under the Medicines Act, a sort of reverse patenting that bans herbs if they are used to make medicines. Hundreds of traditional remedies will disappear. Neem is one of the world's most revered traditional healing plants with many medicinal uses. Among its many uses, it reduces inflammation associated with internal ulcers. It is so effective that pharmaceutical companies have tried to patent this plant. This bill classifies this herb as suitable for external use only, effectively banning its traditional use for unexplained reasons. This popular form of vitamin C is banned because it contains a derivative of lecithin, commonly used in chocolate and other supermarket products, which is classified by the bill as for external use only. Restrictions on traditional Indian, Maori, and Chinese medicine. The bill will restrict the traditional practices of large ethnic communities, including Maori, and violate the Bill of Rights. More than 150 commonly used Indian herbs and a similar number of Chinese herbs are restricted or banned by the bill. To a large extent, this is because many traditional herbs have been found to be so healthy that they have been used to develop medicines. There are more than 10,000 traditional healing herbs. It would cost more than $100 million to register their healing properties, so their use will likely cease in New Zealand. What will it cost you? Last week, this 50-gram packet of Rubia cordifolia, a herb used to make a healthy tea, cost $8. After the bill is passed, the same packet will cost $60 to $80 due to compliance costs. There are over 100,000 edible plants. It will take an army of civil servants years to classify even a small proportion of them. Assessment costs will be paid by industry, and so the cost of natural health products will rise dramatically. What will escape regulation? Unhealthy products will be allowed to be sold without regulation. Therefore, sugary drinks, tobacco, and alcohol will continue to be sold unimpeded, while the government pours millions of dollars and years of fruitless effort into controlling products that are already known to be safe and healthy. This would be ridiculous if it wasn't immoral and criminal. There is a crisis in healthcare. Prescription drugs have become the third leading cause of death. Healthcare costs are spiraling out of control. Mental illness has quadrupled. Cancers, chronic diseases, and many other conditions are increasing to epidemic proportions. Clearly something has gone horribly wrong, but no one knows quite why. There is no doubt that food additives and the drugs we take play a pivotal role in the development of disease. There have been multiple failures in the regulatory processes which approve agricultural practices, food, and medicine. How has this happened? The process of regulation has moved away from science and become a cozy relationship between industry and regulators, permitting unsafe and inappropriate products onto the market. The Natural Health Products Bill represents a new phase of this cozy relationship. Regulators worldwide are cooperating to place restrictions on natural health products which will only benefit multinationals. What can we do to reverse this trend? There is a standard scientific approach to identify cause. Eliminate suspected causal factors and reintroduce them one by one. Dr. D. Mangin at Otago Medical School has found that if you stop all non-essential medication of the elderly, they improve. Dr. Julia Ruckledge at Canterbury University has found that greatly improved nutrition benefits children with ADHD. Dr. Kulreet Chowdhury, a renowned San Diego neurologist, has found that her patients, including MS sufferers, improve dramatically when placed on a traditional herbal diet. These are pointers to exciting scientific preventive approaches to healthcare, which are springing up everywhere at this time. So why is our Parliament planning to restrict natural health products? We need to remind ourselves there is no evidence that natural health products are unsafe. In fact, there is a great deal of evidence that they benefit health and prevent illness. Natural health products are traditionally made from plants and animal products which are based on DNA and natural minerals. Our digestive system has developed to easily metabolize food based on DNA without side effects. Many people rely on natural health products to maintain their health. It would be criminally negligent to restrict their options. True natural health products are, in fact, foods. There is nothing risky about their use. Taking natural health products is no different than the need to have a balanced meal. Food is life. It is our first medicine. The healing properties of plants are proven to benefit public health. Our right to use them should not be taken away by law and offered to pharmaceutical interests. We are a people who believe in fairness. This is not the time for New Zealand to become involved in an international effort to subvert regulatory safeguards. This is not the time to restrict access to preventive health care. This is not the time to allow suspected unhealthy synthetic ingredients to be included in natural health products. This is not the time to restrict access to herbs and impose huge unjustified costs on traditional medicine. This is a time for New Zealand to lead the world in the development and application of preventive approaches to healthcare. The Natural Health Products Bill is coming up for its final reading shortly. Ask your MP to review this presentation, which shows that the bill relies upon outdated and discredited ideas. Ask that this bill be removed from the order paper before an injustice is done to the scientific method and to public health. For more information, view my YouTube video, Why Are They Regulating Natural Health Products? Or contact Dr. Guy Hatchard at ghatchard@gmail.com. Thank you.